Hey guys, Dr. Ina, Dr. Maha, and a special guest today, Dr. Bruno. He's here with us as an emotional support. And we're here today to talk about blood tests and vitamins and minerals. A lot of people ask us questions like, can I measure my vitamins? Or I go to the primary care and the primary care physician measures all the values, and it's not necessarily true. Primary care physicians, they measure only the values of how they think the most important vitamins, such as B12, folate, vitamin D. But we're not as simple as the three vitamins. We have a lot of vitamins, minerals, antioxidants, amino acids that have to be measured in the blood, but through a very specific lab called functional lab. They have a special equipment that actually measure the value of the vitamins that not circulating in the serum, which is the liquid between the cells, but they actually have an ability to measure all of these values inside of the cell. And I can give you an example. Let's say you come in, you're getting a lot of B12 injections with, let's say, weight loss. And the doctor said, stop B12 because your values are exceeding the normal value. But it's not necessarily what's circulating in the serum will affect your health. We want to know how much of the B12 is actually penetrating in the cell. And you can be very, very surprised that people whose values are showing on a regular lab exceeding, they're deficient on the cellular level. And also, Dr. Maya, please tell us, what do you think about the lab values that shows sometimes too much and the doctors start panicking that you can overdose? So does it really matter about the numbers that are too much? And does it really depend on the culture, ethnicity, and all of those factors?
So yeah, testing, lab testing, I'm not going to say even blood, right? Because there's a urine testing, there's serum, there is saliva, and obviously there is the blood, even there's stool testing. There is a lot of misconception as to when you go to a regular doctor covered by the insurance, and you say check everything. So doctors are trained to check for, there's come the basic tests. So they regularly will check your electrolytes, they'll check your kidneys and liver, sugar obviously, and the kidney, the liver, the blood, right, the CBC, like whether you have anemia or not. And recently, and I mean last 10 years, vitamin D became a part of the testing. Before that, nobody thought of testing it, and B12. Folate, you not regularly tested. Usually it's mostly for pregnant women. So there's a lot of the reason why in America we test certain things is, again, there's a lot of it has to do with what insurance approves of. Thyroid testing happens if there is suspicion, or at least once a year, and sorry, cholesterol, I didn't mention that. So these are good tests. So, but they're not sufficient to fine-tune. So you will only find problems if there is a serious disease, an illness that has manifested in the body so much that only now is showing in the blood. And I agree fully with you that testing the blood will show only the levels in the blood that is circulating. It doesn't indicate what's going on inside the cells. So as an example, people with diabetes, when you test them, what do you find? You find a lot of sugar in their blood, right? But what is the problem with that? Like, other than the fact that the sugar itself has issues, the problem is that that sugar is not going inside the cells. And the cells are deprived, they don't have energy. That's why we give insulin or sugar or treatments, because we want the sugar to enter the cell to work. So the same concept with vitamins. The vitamins could be going everywhere. What if they're not going inside the cell? The cell is not getting it. So instead of, and the limitation of the blood testing is that it won't be able to tell you that. That's why there's a lot of blood testing that is available. like the one that you have in your clinic?
Yes, so I would like to talk about that. The name of this test is micronutrient, and it's done by a certain specialized lab that this is their niche. And we don't get the results like a regular blood test in a day or two. It actually takes 2 weeks to process and get the report going. Plus, the beautiful thing about this lab that they give a lot of education to the patients. So it's not only that system like exists in the primary care physician offices where the front desk calls and say, hey, everything is normal with your blood. And majority of patients, they don't even know what they took.
What did they test?
What
right?
values they actually are talking about. So the patient gets an amazing report, and it's a very clear report that has 33 pages, but it's a very clear report to non-medical person to see what exactly they need to work on. And the beautiful thing about this this thing that they check pretty much every single nutrient that can affect our health, from vitamins, fat soluble like vitamin A, vitamin E, vitamin K1, K2, all the Bs, in addition to minerals, that without minerals, vitamins will not work. So they're actually the working force. Then the metabolites like choline and inositol and carnitine and sodium and potassium and amino acids and the antioxidants and the good and the bad fats. And so you're getting all of this information, plus they explain what each vitamin and metabolite does.
Nice.
So in what foods it contains, what symptoms you might get without this certain nutrient. So I encourage, it's the beginning of the year, I really encourage everyone to take this test. Doesn't matter if you're healthy or you know, fighting some kind of illness. Especially if you're fighting the illness, you should know what vitamins and minerals you're deficient, because you will help your body to heal itself if those vitamins and minerals will be well replenished. And but if you're just a wellness enthusiast, you know, you have to know what you're actually take. Do you need to take those supplements, or maybe you should take a break? Because another problem is, I think people overtake supplements just because they hear so much information on the social media platforms. You should take that and you should take that. So we sometimes overdo it.
I agree.
And so I don't say that you should take micronutrient test every month, but maybe twice a year.
Yeah, I agree.
It should be a good idea.
I agree.
Can you, Dr. Maha, can you please tell us a certain ethnic groups? How are they different, let's say, from a regular statistics, even though when we live in America, everyone is going through the same statistics?
Yeah, that's true. So one of the main things is like the what's considered normal values. It was based on studies were done in the military in America. So obviously it reflected men in their prime life, mostly Caucasian. And they tested all of them, and they saw all of them, you know, what was the range of the results, and they said, okay, that's the important, that's the normal values. And then I don't know if they inferred the female or they just tested the women in the military as well. But the thing is that we have to remember, there are like different ethnic groups, right? There is the blacks, there is the Mediterraneans, there is the Asians. There's the Pacific, you know, each one of them will have, their bodies are not exactly the same. So for instance, if you go to the Middle East, you will say, oh my God, everyone is iron deficient. But the truth is they're not. It's just that their bodies run naturally on lower levels of iron, and they're okay with it. Their bodies, genetically, they accustomed to that. So something like this test that you talk about, the micronutrient, what I like about it will give us a clear picture of what's going on inside the cell. And obviously, we don't treat lab tests. That's one of the things we have to remember. We treat symptoms. But the lab test will give us an indication. Like for instance, if somebody comes and we test their thyroid and it looks like a little abnormal, but they say, we feel fine. We're not going to give them treatment, right? But we will keep an eye on them. Like, okay, let's check you instead of once a year, let's check you every 3 months maybe. And vice versa. If somebody comes and they have symptoms, and actually that happened to a family member of mine, they were having very clear symptoms of hypothyroid. I mean, it was classic. But every time she went, she was in another country, and they test the thyroid and it looks normal. And I said, I don't care if it looks normal on the testing. You're having the symptoms. Eventually, after a few years, the blood test started to show it was lower. But she went a few years without treatment.
But you see, there is understanding as well, normal and optimum,
Yeah.
functionally normal. So let's say we take TSH, thyroid stimulating hormone. It's normal starting from 0.5 to 4.5.
Yeah.
So obviously, if you are 0.5, it's such a huge gap between
This one
normal, then obviously with 0.5 you will feel completely different than with 4.5, and you will still be considered normal.
Yeah.
But if you go to the functional medicine doctor, then normal would be 0.5 to 1.5. And anything above 1.5 will be considered to be abnormal or problematic. So it's important to understand and educate yourself. What are you trying to achieve?
Yeah.
Because some people, they're just okay without developing any, optimum results.
Yes, yeah.
A lot of people, like if we just say like common people in every country,
Yeah.
they're okay looking older or their age. They're okay having maybe extra 20 pounds, and it doesn't bother them.
No.
There's like when they were younger, they were skinnier. Now they're, increasing the weight, and it's normal for them. But if we really want to live long and healthy, I think we should change our mind in terms of what values are we looking at, and how we're treating our body, what blood tests are we, or not blood tests, but any type of test that we take, which one are the best ones.
I agree with what you said about the supplements too. I didn't get to point on that, like comment on it. So you're right, like every now and then, right, there is this miracle supplement that comes out, and you have all these YouTube tests and everything saying this is it, this is the elixir of life, and everyone rushes to take it. And the truth is, these supplements and these materials, and they are helpful to some people sometimes, right? There's no supplement that is helpful to everyone all the time. It depends on the person, which stage in their life, maybe even like part of the year. I'm not an advocate of taking the same supplement day in, day out, year after year. That's never a good idea. It's always good to take breaks so that the body doesn't desensitize to it, and gives you time to get other kinds, like rotate, And tests like these will help you get a baseline as to, okay, because the supplements, they're like endless, thousands of them. No one can take thousands of supplements, I mean, if you want to do it, good for you, but you can't. So something like this will give you a guideline. Well, okay, well, I tend to be low on glutamine, which is an amino acid. Okay, then let me make sure the supplements I take for the next 3 to 6 months are rich with amino acids, especially glutamine, right? Glutamine has a very important function for the brain function and for the gut.
Yes.
So, so that way you're like, the glutamine. And then, instead of taking, I don't know, like calcium all year long, every year, you might think, okay, I don't think I need to take the calcium because my calcium looks good. And instead I'll take something else, like magnesium or something. But why take things blindly if you know that there are tests that will help you, at least guide you as to what to focus on when, So that's my idea about this.
And I wanted to share my results for this test because I'm taking a lot of supplements on a yearly basis. Yes, I rotate them. I don't take the same supplements over and over again. But when I took this test, it got me to surprise that, and I'll share my results. I was only abnormal, like I was normal in all the vitamins on the serum level. It was great. But actually abnormal showed on the cellular level that I was deficient in vitamin K1, in folate, and serine, the amino acid.
Okay.
You know, so, and even though my primary care took folate as, you know, as a marker, and it was always normal. So again, it showed on the inside of the cell. So what do I do now? Yes, I take vitamin IVs, you know, so the absorption is a lot better because it goes directly into the blood. And, you know, change my diet, removed, let's say like, or reduced, not removed, reduced gluten, dairy products. So improved my digestive system, so the absorbency of the vitamins become much better. So guys, I think it's inevitable.
Yeah.
If you want to be healthy and know more about your body, you should educate yourself first, always, and go deeper and understand why your body needs all of these nutrients that we talk about. Anything else you would like to add? Like, let's take urine test. Some people say that urine test is the most potent test. Not even urine test shows better results than blood. Is that the right thing to say?
It depends on what you're testing. For instance, thyroid testing, you know, the TSH and the thyroid function has to be blood. Urine will not give you. Urine is way superior when it comes to testing hormone levels.
Okay.
So it depends on what you're testing for. Also, urine tests are like many kinds. So there's the traditional one, which is you collect the urine over 24 hours, and that's what is usually used. And there's the new testing, like the Dutch test, and I think the other one I forgot, Genova maybe. They take actually, you just pee on a sample, and then they take that urine and they can get a lot of information. And I really love the urine test, specifically for the hormones. And it's also very good to help us know, for instance, you take a supplement, right? Is it staying in the body or is it coming out of the urine, or what's going on? Are you losing it? So that the urine test will also help with that. So that depends.
As a summary, if you go to the primary care physician and they check your blood test, that's kind of like a basic testing that you shouldn't rely on at 100%.
Yeah.
Then if you want to check your hormones, the best way to check your hormones would be through urine.
Yeah.
If you want to check your cortisol level, the blood test will not show specific results. So the cortisol level, everybody talks about cortisol, it's a stress hormone, and a lot of people experience deficiency or excess in a certain time. So saliva test would be the best choice of liquid, of specimen to check the cortisol. Then the blood test is, the most common one. It can give you a lot of results too, but it depends on what lab you're using.
That's true.
And there are a lot of holistic clinics or alternative where they don't even take that. They only take hair sample. And that can also shows a lot of deficiencies, especially when it comes to mineral deficiency, right through hair.
And heavy metal toxicity is very good for that, actually.
Yes.
Yeah.
And one of my favorite testing would be bioresonance, which you tested through the frequency, through electromagnetic field. So let's say for kids who are truly scared of blood tests or any type of testing, bioresonance, which is not an acceptable testing for the medical community, but for the alternative community, that would be a great indication of what you are deficient as well. So there are so many ways of how you can check what truly inside of your body and what direction you want to take.
So yeah, one of the other things, like you'd think, okay, why should I check all these weird names? Because vitamins don't work by themselves. The body is such a complex organism. So the vitamins and the hormones are the big ones, are the famous ones, but there is something called coenzymes, and there is something called coefficients and cofactors and helpers and metabolites and things. So there's a lot of things that we need. So even if you, for instance, you have the vitamin, but if you don't have the things that will help it work, then it's like nothing, right? Doesn't matter if your vitamin D is sufficient if you don't have the supportive entourage to help it actually work. So that's why these things are important.
Yes. So don't wait. It's 2026. Happy New Year to everyone. So if you truly want to take care of your health, be more educated about that and use the labs that are available wisely.
Happy New Year.